Today on the Cruz Orthodontics podcast, we're talking about the bonded retainer robot that Dr. Cruz brought into his practice. He only brings in the best technology, so you're going to want to hear this one. Stay tuned. All right, Dr. Cruz, what inspired you to bring this robot into your practice? I know you're picky about technology that you bring into the practice.
We've always had bonded retainers as kind of part of our retention for our patients when they get their braces off or when they're done with their Invisalign. But fundamentally, these bonded retainers come with some issues. As a side note, there are a lot of dentists and hygienists that aren't big fans of bonded retainers, and understandably so. The biggest reason being that when you place these bonded retainers, it's hard to keep them clean. Sometimes they can be a little bit bulky. And so we've been trying to use bonded retainers for many years now to the best of our ability, and you sort of place them chair side and they can be a little bit generic. And so when I actually, oddly enough, I happened to be scrolling through Instagram and it came across this ad showing that there's this now new robot that's able to custom bend the wire to the patient's teeth so that it's perfectly formed to their teeth, making it much more sleek, much more comfortable, easier to clean. So I reached out to the company, and we're actually starting to develop a great relationship because they've got some other amazing products coming in the future. And so within the last month, we've actually acquired the robot, and we've been using it, and it's been outstanding. You're always a little bit leery in the beginning, thinking, okay, is this really going to live up to the hype? And these bonded retainers are fantastic.
So I heard you nickname this robot. Did you have a story about that?
There were a few days there where we were trying to come up with nicknames. The name of the company is Yote, and didn't really roll off the tongue all that well. And so we weren't going to call it Yote. And then we started thinking about, Star Wars with C-3PO or R2-D2. And then one of our staff members mentioned Wall-E, which I thought was always kind of a cute animated cartoon that my daughters used to love. And so, yeah, we landed on Wall-E.
All right. So someone who's never heard of this, which is probably most of us, can you just explain in simple terms what this robot is?
Yeah, absolutely. So there are a couple of steps to be able to actually create the bonded retainer. So we start with our digital scanner, which, we've had for years. And then we send that scan to a laptop that's connected to Wall-E. And so then from that point, we can use the software that this robot comes with to custom design and contour the bonded retainer behind the teeth exactly the way that we want it. And then once we get the design just right, we send that to the robot, and then it actually takes a straight wire. And it's pretty cool because there's an internal camera in there, so you can actually see it bending the wire. And so it bends the wire, cuts it, and then basically drops it into a receptacle so that you can get the retainer to then place on the patient. And so one of my big concerns was, how long is this going to take? Because you're having to do all of this kind of real time, but it's surprisingly smooth. So it takes us probably an extra 5-10 minutes to the appointment where our patients are getting their braces off, but it's well worth it.
So what is the problem it's solving compared to traditional bonded retainers?
The first thing to consider is that most offices actually give their patients removable retainers, and there's nothing wrong with removable retainers, assuming their patients are wearing them. And so, for the better part of my early career, the first 10 or 15 years, we would give all of our patients traditional retainers. And what would happen is most of our patients would do a fantastic job of wearing those retainers for the first few months, maybe even the first year. That compliance would slowly start to dissipate. And I get it. You've got a lot going on in life. And so trying to be consistent with wearing retainers for years and years can be tough. It can be a challenge. And so then we started to look into doing bonded retainers. At the time, I felt like we found the best possible option to be able to do these bonded retainers. But to the point that you were just asking about, the issues were always sort of twofold. One was comfort. You have to remember how sensitive the tongue is. So when you're placing something behind the teeth, it's right there for the tongue to be able to kind of explore and play with. And so you want to make sure that it's as sleek as possible. And then the other thing to kind of think about too is how easy is it to keep it clean? The last thing you want with a bonded retainer is something that keeps your teeth straight. Okay, that's great, but it's at the expense of not being able to keep your teeth clean. And now you've got gum disease or cavities developing. And so with this new bonded retainer, this new robot that makes this retainer, it's so much more comfortable. We're still in that early phase. And so we've probably delivered about 20 to 30 in the last couple of weeks. And I'm constantly asking our patients that receive these new bonded retainers, how does it feel? You okay? I'm really making sure that this is living up to the expectations. And oftentimes patients don't have a reference. And even these patients that have never had a bonded retainer said, oh yeah, this is fine. This isn't going to bother me at all. And then when they come back for retainer checks, we get to see how things are looking. And it's still clean. We're not having any issues with patients being able to floss around it and keep it nice and clean with brushing. So those are the two big issues: comfort and being able to keep it clean.
Can you kind of dive a little deeper of how it's doing that? Like what makes it more comfortable and easier to clean compared to the old
It's
one?
all about the contouring. And so, it's a great question because, in an ideal world, you would be able to take a wire and use your hands and bend that wire to conform to every patient's, set of teeth. But, the issue is you've got to remember that the area that you're working on is behind the teeth. And so when you're trying to place a wire and you're trying to custom bend it, it is incredibly difficult to get those bends. And so now with this machine, these bends are spot on perfect. So it's actually really exciting because when you get the bonded retainer made from the robot, we'll go ahead and then just place it before we glue it on to make sure that it's a good fit. And it literally fits like a glove. And so now you don't have any places where the wire is away from the teeth, which can create what we call undercuts and little nooks and crannies for things to get trapped, right? Food and plaque and things like that are going to now get stuck under it, and it's going to be annoying and hard to keep clean. So if you can have that wire perfectly contoured and the robot just does a better job than you can by hand. And then placement of the glue, that's also critical. So, we've been spending a decent amount of time over these last few weeks really making sure that we have our process dialed in so that the glue that we use to bond that wire to the teeth is really smooth and really low profile. And so between the two, yeah, it's worked out really nicely.
Dr. Cruz, I've heard you call these retainers jewelry for the teeth. How have patients reacted to how they look with them?
It's funny when I show patients pictures of these bonded retainers, because oftentimes when it's time to get your braces off, we say, okay, let's talk about retainers. Let's come up with a plan here. And obviously I'm biased trying to encourage them to do the bonded retainer just because I feel like it's the best option. So I'll bring a picture up. And so the first reaction is usually like, oh gosh, you can hardly even see it just because this is so much smaller than the other type of bonded retainer that we used. But you can see the wire itself. And yes, it is real gold, which, I think is kind of cool. I mean, the shade of the gold compared to typical silver wires that are used, I just think matches with teeth so much more beautifully. And then the other thing too is that gold is just a great material as far as being used in the body and not having any adverse reactions. And it's also just, it's beautiful. And so, yeah, most patients are like, oh yeah, that looks cool. And so, I don't know if it's because I'm hyping it up because I think it's so cool, but I think it's actually beautiful, particularly because it's just so well formed that it just looks like it belongs. I think that helps a ton as far as it really neatly sitting on the teeth as opposed to something that seems forced on the teeth.
What's the role of digital scanning in helping these retainers fit so tightly?
So the digital scanners are, as we well know, are incredibly accurate, right? And so we use those oftentimes to be able to create aligners, to be able to, move patients' teeth. And so, we've used scanners for ages and ages, and they're accurate down to the micron. And so if you can use that digital scan as the initial information for the robot to use as a guide, that you've got really, really accurate, basically digital impression of the teeth. And so you want to make sure that whatever the robot is using as a guide to bend the wire is exactly the same shape and size of the teeth. So those digital scanners come in handy to be able to use as a reference for the retainer robot.
As far as we're talking about comfort and cleanliness, is there anything about this bent wire that helps it last longer or be a better long-term solution compared to the traditional?
I think it will. I mean, I don't want to misspeak just because we've only been using this for about a month now. But the reason why I'm confident that this is going to last a lot longer is that if the retainer is bulky in any way, you can imagine that when you bite into something, if there's a ledge for food or something hard to catch on that ledge, it's going to pop or debond the retainer off of the tooth. And so because it fits so sleekly, I don't know if that's a word, but because it's so sleek and because the composite is rounded and low profile and smooth, anytime that you bite into something, it's going to sort of glance or roll off of the retainer and not catch it and want to pull it off. So I'll be shocked if we don't, get a significantly greater amount of time with these retainers lasting.
So are you saying it can probably give you less repairs over time that you're going to have to do with the patient? And what about adjustments? Are adjustments something you do with a bonded retainer?
No adjustments. That's definitely one of the advantages, but repairs can be an issue. Oftentimes, it's our teenage patients that decide to get a little aggressive or a little rough with what they're eating. You still want to be careful with things like ice or, maybe a hard raw carrot. I mean, there's certainly things that you've got to be a little bit careful with. But generally speaking, the amount of repairs that we have to do in general are pretty low with the old type that we used. And I think now with this new one, well, here's probably a good guide, is that of all of them we've done thus far, we haven't had to do a single repair yet, which is a good sign.
How about the long-term stability of the patient's smile? Do you think it's going to improve that?
That is one of the biggest things that patients don't really take into consideration, and understandably so, right? You come to get your teeth straightened and your bite fixed, and it's probably the first time that you're doing it. And so, most of the time, our patients are really fixated on, okay, what are you going to do to get my smile the way that I'd like it, to get my teeth straight? And very little attention is devoted to, okay, once they're straight, what are we going to do to keep my teeth that way for the long term, right? And so, I make sure that we take the time to discuss that at the new patient exam, because in a lot of ways, we as orthodontists are hyper aware of what we're going to do for retention because it's such an important consideration. It's not uncommon for teeth to want to shift throughout life. And I don't think a lot of patients understand that. Or there's a bit of a misconception that it's the wisdom teeth that are always causing teeth to shift. So once I have my wisdom teeth removed, then I don't have to worry about my teeth shifting anymore. Unfortunately, that's not entirely true either. And so the beauty with these bonded retainers now is that we don't have to worry about any sort of relapse. What is by far the most common is relapse of the lower front teeth. Those are the teeth that tend to get pushed around the easiest and relapse and become crowded again. And so a lot of the research has shown that if you can hold the lower front teeth in their correct position, interestingly enough, it'll actually help hold the upper teeth in their correct position, even though you don't necessarily have a bonded retainer on the upper. And so, from a long term standpoint, they are heads above what removable retainers can do as far as keeping the teeth nice and straight.
So do you predict it's going to reduce the need for retreatment or maybe even totally eliminate it?
Yes, absolutely. And, you would think that orthodontists would welcome retreats, but I cringe and I hate having to retreat our patients because, I just feel like the last thing I want to do is potentially have to treat a patient a second time. There could potentially be fees involved again. It's not the way that I want to operate. I want this to be an amazing experience. I want it to be a one-time deal. And so it's always a little bit tricky when patients come back and their teeth have shifted. It doesn't necessarily leave a warm, fuzzy feeling for anybody. And so my goal is that they come and see us and we do the treatment one time and that's it.
Yeah, so this is a really new technology, I'm assuming. So most orthodontists don't have it yet. How do you think this is going to set your office apart?
I think that education is going to be a big factor with regards to this. So we're making sure that we take the time to discuss why we do bonded retainers for starters, and then why we use this robot to be able to make these bonded retainers. Like I said, I think a lot of patients think of retention and retainers as an afterthought. And like I said, it's understandably so. And so I think that once they understand, oh, wow, yeah, I want to make sure that my teeth do stay straight after I'm done with this whole process. And I want to make sure that I have the best option that isn't a burden on me. And so I think that once patients see how amazing our bonded retainers are, I think it becomes a no-brainer that that's what they would choose.
So do you see these bonded retainer robots becoming standard in practices in the future? What are your thoughts about that?
I'd like to say yes. Unfortunately, I think the answer is probably no. And the reason I say that is that I look at a lot of the better technologies that our office has adopted over the last decade, and I'm still looking around the community to see if other offices have also adopted these technologies. And a lot of them haven't. I think, unfortunately, it comes down to cost. I think a lot of offices are still trying to buy the least expensive braces and provide service in a way that, is probably geared towards being the most profitable. And I just don't think that's the way to go. And I think eventually what's going to happen with a lot of orthodontic offices, unfortunately, is that the gap between excellent care and mediocre care is going to get so great that they're going to get left in the dust. And so, I'd like to think that other offices would use this technology, but I have a feeling that if it is adopted, it's going to take many, many years.
That is really surprising because the industry as a whole is so innovative. I mean, even when AI came out, y'all were using it right off the bat. It was pretty amazing.
Yep, exactly. And part of it is sort of understandable too. I'm getting a little long in the tooth myself. I'm not a spring chicken anymore. And so I think all of us can kind of relate to the idea of like, okay, how much time and energy do I really want to devote in staying up to date in whatever career you're in, right? And so I think a lot of us can become a little complacent and comfortable with where we're at. And I think that's also what's happening. And so sometimes I have to give myself a little kick, like, come on, let's stay relevant and let's stay, up to date.
If you could improve or expand the technologies or anything that would be on your wish list.
There is, and it wasn't my doing. In fact, this is probably what I'm the most excited about, and this is what attracted me to this company, is that the next step, and I'm hoping it will be before end of calendar year, is a very similar robot, but that robot is now going to be able to custom bend the wires that we use for patients to be able to adjust and move teeth and straighten teeth. There was this time similar to the bonded retainers where you would mark the wires and you would hand bend them. And as good as we can be as humans in doing that, inevitably, you're not going to get the bend large enough, or maybe you made the bend too big and you overcorrected. And so now you have to spend more than just one appointment detailing. And so from an efficiency standpoint and from a comfort standpoint for the patient, we'll now be able to have a robot that custom makes the wires to get the teeth in the right position more efficiently and more comfortably. So I don't know what we're going to call this robot. I'm super excited to get it. That's going to be amazing.
All right, so if there's one thing you want parents to remember about this robot, what would you say it is?
I think the biggest thing to remember here is that, and I know I'm repeating myself a little bit, but it's just understanding how important it is for keeping the teeth straight after treatment is done and what is the best way to do that. And so, like I said, so much of us are fixated on, okay, straighten my teeth. And then it's almost like there's this big sigh of like, okay, I'm done. My teeth are straight. And so that's where a lot of orthodontic offices say, no, you're not done quite yet. Now we've got to worry about retainers. Here are these removable retainers that you have to wear for the rest of your life. And it's kind of like, wah, wah. You're like, wait a minute. I don't want to have to wear these retainers for the rest of my life. That seems like a big responsibility. So I want people to know that we have an option now that isn't going to be cumbersome, that's going to keep your teeth straight. It's not going to impact your daily life. It's a great option for our patients.
Cruz, thanks for introducing us to this, and we'll see you on the next podcast.
Yeah, thank you.